A shower in spots for the afternoon. Our high today 45. Cloudy with a rain or snow shower in spots tonight, low 36. For tomorrow, it'll be a chilly day. Couple of showers of rain or snow. Then windy. Look for a high of 42. On Sunday, colder. A bit of snow at times. A little or no accumulation. High Sunday 32. I'm Steve Williams for News Talk 1480 WHBC.
The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass and Januar Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our special guests are Dr. Kirby Sweitzer, past president-elect, and Meghan Woods, RN, cancer nurse navigator with Cleveland Clinic Mercy Hospital. Good morning and welcome to the show.
Good morning.
Okay, colorectal cancer is the third most commonly diagnosed cancer and the second leading cause of cancer deaths in men and women combined in the United States. The American Cancer Society estimates that 147,000 people will be diagnosed with colorectal cancer and 53,000 people could die this year from the disease in 2020. On average, lifetime risk of developing colon cancer is about 1 in 23 for men and women combined. However, this varies widely according to individual risk factors. Since the mid-'80s, colorectal cancer survival rate has been increasing due to, in part, increased awareness and screening. Finding polyps and cancer in the earlier stages is the easiest to treat. Improved treatment options also have contributed to a rise in survival rates. We'd like to remind our listeners today that this program is going to be available on our podcast, and you can download that from the App Store on your mobile phone.
Okay, Dr. Schweitzer and Meghan, welcome to the show. Doctor, you've been on the show before, and we're glad to have you back. If each of you take a moment, please introduce yourselves to our audience.
Meghan?
Yes, I'm here.
I'll start. I'm Kirby Sweitzer. I am boarded in general surgery and colon rectal surgery. I've been in practice 29 years, a long time. That's about all I have to say.
My name is Meghan Woods. I'm a registered nurse. I'm one of the cancer nurse navigators here at Cleveland Clinic Mercy Hospital. I've been a nurse for going on 21 years and have been a part of oncology for the past 3 years. And we're very happy to meet and talk to people about colon cancer today.
So, March is National Colon Cancer Awareness Month. Why is this such an important focus?
Well, I think that it's important to have a designated time where we can talk about and people are more aware of colon cancer, rectal cancer, and take actions to prevent it or to get screened. This gives us an opportunity to talk to our family, our friends, our patients, other people, our coworkers about the importance of screening for colon and rectal cancer. This is a disease that we can screen for effectively, and by screening, find the disease before it actually becomes a cancer or in the early stages when it's much more curable. We all hear about breast cancer because of the active aspect of women. We don't hear much about prostate cancer and not much about colon cancer, though colon cancer affects both men and women about equally.
So, colon cancer, how common is it?
Well, as Brad's mentioned, 1 in about 23 people are going to have colon cancer in their lifetime. So it is common. It is an aspect that it's the third most common cancer in both men and women, and it's the second leading cause of death. in the United States, and this is according to the CDC. So colon cancer is lumped all together throughout the whole aspect of the large bowel. But then there's also kind of a subgroup called rectal cancer, which is also considered a sub-branch or a subgroup of colon cancer.
Okay, I understand this is not a subject for discussion around the dinner table, but why don't we hear more about this colon cancer?
Well, I think it's difficult because when people come to see me in my office and talk about their colon, their rectum, their anus, it's embarrassing. People say, "Boy, I wish I wasn't here." So I think it's something that people don't want to recognize, that people don't want to talk about, and it's hard to tell that. So many times people will come in and say, "Well, I just have a little change of bowel habits. I just have a little bit more constipation, predominantly sometimes diarrhea," and they don't want to talk about what is going on with their bowels. The colon is an organ of social convenience, so it's difficult. Any sort of cancer is hard to talk about. I believe it's challenging, but when you add the bodily functions of going to the bathroom, moving your bowels, that sort of thing, it makes people very uncomfortable.
All right, so let's talk about what causes colon cancer, and is there anything one can do to prevent it?
Well, you can definitely decrease your chances or your risks of colon cancer. Can you absolutely prevent it? No, not really. But if you do screening appropriately, you have much higher chance of picking out the neoplastic or the new growth of the tumor before it becomes a cancer, an invasive cancer, or catch it very early. Cancer is caused by changes in the DNA. So you have the lining of the colon is a high turnover cell type, meaning that cells turn over a lot. So there's more chance of having problems with the DNA. And when you combine a couple changes in the DNA, then you end up with a neoplasm or a new growth, which is oftentimes a polyp. The vast majority of colon cancers come from polyps. The DNA mutations turn on genes called oncogenes, which are genes that encourage tumor growth, cell growth, and then turn off suppressor genes, which decrease abnormal growth. So sometimes we don't know how these changes take place, but we can definitely understand that those changes are there. We can look at that from a genetic standpoint. A very small portion of colorectal cancers are caused by inherited genes, familiar adenomatous polyposis, things like that. But that's a very small number. The vast majority are because of changes in the individual cell that grows out of control. Almost always, these changes are accumulated over a lifetime. And there's no sure way to prevent colon cancer, but there's things that you can definitely do to lower your risk.
All right, well, we're close to our break. Do you just want to go ahead and take it?
Yeah, we can do that. You are listening to Health Matters with the Medicine Center Pharmacy. We'll be back in a few minutes.
Are you ready for a change? Transfer your prescriptions to the Medicine Center Pharmacy. Hi, this is Paul White from the Medicine Center Pharmacies. Are you looking for the personal touch from your pharmacist and pharmacy staff? Do you need home delivery or custom packaging to simplify a complex medication schedule? Look no further than the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Bring in your prescription bottles, and we can transfer your prescriptions to the Medicine Center today, where wellness begins. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer, You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia.
Spring has sprung at Studio Arts and Glass. The hummingbirds will return, and Studio Arts and Glass has the feeders. Wind chimes, felt birdhouses, and garden art all make great gifts. Are you going to the beach? Then you need sea glass, sterling silver and sea glass necklaces, earrings, and bracelets. Studio Arts and Glass open Monday through Saturday, 10 to 6 on Apple Grove and 77 in North Canton. StudioArtsandGlass.com.
Hi, Paul White from the Medicine Center Pharmacy. If you haven't gotten your COVID vaccine shot yet, you've got to get to the Medicine Center Pharmacies in Canton, Louisville, Minerva, or New Philadelphia. We are waiting for you and have vaccine. Call or stop in your closest Medicine Center Pharmacy, and we'll take care of you. Getting a COVID vaccine will save you from getting very sick. So hurry and get on with protecting yourself. The Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Okay, welcome back to Health Matters with the Medicine Center Pharmacy. Did you know we offer free prescription delivery? Can your Medicine Center Pharmacy call your Medicine Center Pharmacy to learn about our prescription delivery system?
All right. We hear a lot about polyps. What is a polyp and why do we worry about them?
Okay. Let me get to the polyps in just a minute. I'd like to go back and finish what we were saying just before the break about factors that increase the risk of developing colon cancer. And, you hear this over and over for many types of cancer, but, watching your weight, obesity is a cause of all kinds of cancers, are a contributing factor. I can't really say a cause. And then you also have sedentary lifestyle, exercise. Your body is made to move, and it's important to move. Consuming a diet high in vegetables, fruits, and whole grains. Decrease the red meat and processed meats. Avoid excessive alcohol use. And then the big one in multiple cancers is smoking. Avoid smoking. That's associated with everything from mouth and throat and esophageal and stomach cancer to colon cancer to lung cancer to all kinds. So if we can adjust our lifestyle, we can decrease our risk of cancer significantly. Now, you talked about polyps. Yeah. The risk, the aspect of colon cancer, how it forms is the vast majority form from a polyp. So a polyp is a new growth. You have changes in the DNA of the cell that releases that cell from the growth control. And so it just explodes and that forms a polyp. A polyp is not a cancer. So the rule of thumb is the polyps form 3 to 5 years for a polyp to form and 5 to 10 years for a cancer to form from that polyp. So polyps are slow growing. They don't have symptoms usually. And if you can take care of the polyps before they turn into cancer, you've avoided that part of the disease. Regular colon cancer screening is probably the most powerful weapon we have today against colon cancer, fighting against colorectal cancer. And we can find that those cancers can be found early and they can be treated. And if it hasn't spread, oftentimes you can be cured relatively easily. American Cancer Society recommends that people of average risk start a colon cancer screen at age 45. It used to be 50, but now it's age 45 because of the decrease or the increased risk of people that are younger having colon cancer. This should continue till at least age 75, maybe even longer as people are living longer. So I have some people in my practice that are 80 years old or 80, even 85 years old that still want to be screened and they're active and everything else. And they have a history of maybe polyps. And I don't have a problem with that. Ultimately, you need to talk to your physician. Your physician needs to be aware of your history and when you need to be screened. Now, people that do have a strong family history or that have various diseases such as inflammatory bowel disease, ulcerative colitis, or Crohn's are at a higher risk for cancer. So if you have a personal history of polyps or a family history of polyps or cancer, then you want to be screened maybe earlier. And usually the rule of thumb, of course, there could be exceptions, is 10 years before that index case. So say your father had colon cancer age 45, you probably want to be screened at age 35.
So how big are these things, and why do they actually get stimulated to grow? Is it hot foods, highly seasoned this? There's got to be a reason here, okay?
Yeah, well, seasoning doesn't have much to do with it, but basically what you have the lining of the colon turns over quite quickly because food goes through, stool comes through, and it tears the lining a little bit. Those cells get shredded or pushed off, and so what happens is if everything's working normal, these cells, they grow. They're controlled to not overgrow, and then they're pre-programmed to die. So what happens with the oncogenes is they turn off that control, and so what happens is they just grow out of control. So you start having a pile of cells pile up, and then it forms a polyp. They can be anything from very small to large. Are you still with me?
I'm with you.
Okay, I've lost all the screen.
No, I'm with you. Okay.
That's okay. I just wanted to make sure I was still
Sure.
there. So the size can vary from very small to very large. And if they're small enough, they can be removed by colonoscopy. If they're too large, sometimes you have to do surgery.
Okay, so colonoscopy means colon screening. Okay, do we get past the colon during a colonoscopy or not?
Very little. You can intubate or you can get the scope. The colonoscopy is a long lighted tube, basically, with a camera on it that we can see. So what happens is you go through the colon, you look at the rectum, and you can get all the way around to the cecum, which is on the right lower quadrant where your appendix is. Many times, about 80% of the time, you can actually go into the small bowel for a short distance, but it is not designed to go very far into the small bowel at this point.
So we don't get polyps in the small bowel or large bowel, or
Well, the polyps are predominantly in the large colon, and that's where the cancers form. There can be polyps in the small bowel, but they are very rare compared to polyps in the colon. You also get polyps in your stomach, but again, that's much more rare or uncommon than polyps in the colon.
Very interesting. Okay, so Mercy Cancer Center colon experts recommend colonoscopy as the gold standard, yet many people are reluctant to pursue the screening. Tell us about the colonoscopy procedure.
Well, the hardest part about it is cleaning your colon out. Most people tell me that is the hardest part. So the day before you have the colonoscopy procedure, you have to pretty much purge yourself, and that can be uncomfortable, and the toilet becomes your best friend at that point. You come in, and we usually do this with sedation, almost always, and the procedure takes about a half hour to an hour. Medications are given either by a nurse anesthetist or an anesthesiologist or by the surgeon, and then the scope is passed through the colon, and you can actually see things. And the advantage of the colonoscopy versus some other screening measures is that you can actually see the lining, and you can actually biopsy or remove anything that you see. So a small polyp you can remove, and it can be recovered and sent off to pathology to see, if there's something to be worried about. But the prep is the hardest part. You basically lay on your side and expose your bottom, and usually you're sedated by this time so that you don't really care, which is nice. better living through chemistry in some ways. And it is the gold standard because it is the only one screening test that you can actually intervene at the same time you do the test. You can visualize, you can see abnormalities, you can take biopsies, and any other test that you do, the CT colonography, where you do a special procedure with a CT scan to look at the colon. Any sort of heme test or testing the stool for blood, or DNA tests such as Cologuard. If any of those come up positive, you still have to do a colonoscopy. So colonoscopy is considered the gold standard, even though there are some risks. There's a slight risk, less than 0.25% of perforating or poking a hole in the colon. And depending on the prep, you can miss lesions also, but usually those are small and kind of inconsequential at this point. And since it's so slow growing, you can usually catch that on the next time.
So the Heme Occult test is kind of out. Is that correct?
No, it is still a very good test. It basically looks at blood. So when you're looking at the Heme Occult test, it is limited to just looking at blood release in the colon. And that gives you an idea that whether there may be something wrong. There's a lot of reasons you can have blood in the colon. Everything from gastritis, because that is going to go down through the small bowel of the colon, to something that's not even really associated with colon cancer at all. So the next test up is the DNA test. Everybody's seen the little box on the TV, the commercials, Cologuard. And that's really the only commercial test right now that tests both for blood in the stool and for DNA changes. So it actually looks at changes in that DNA and can pick it up. It's really good test. It's very accurate. It's over 90% accurate. There are a few false positives, which means it can come back positive and you not have any sort of neoplastic growth or anything. And then false negatives are the ones we worry about more, where it comes back negative, but you really do have a growth that just missed it. But those are very, very small percentage. So it's good to do these screenings. So yeah, the blood hematocrit test, the FIT test, all those things are still good, but they're less specific and sensitive. So you start out with hemoccult, the FIT test, which is another type of blood test to test for blood in the stool, and then something like the Cologuard, which is the DNA test, and then you go on into the colonoscopy aspect.
Okay, it is the bottom of the hour. Time for the news. You are listening to Health Matters with the Medicine Center Pharmacy.
WHBC AM Chem, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC newsroom, the number of people applying for unemployment benefits dropped to its lowest level since 1969. According to the report from the Labor Department, jobless claims dropped to 187,000. Climate change isn't just making our oceans warmer, it's also making them louder. Scientists say that warm water conducts sound waves better than cold water, which researchers say could create so-called acoustic hotspots in the future. And that could have a major impact on ocean life, since many sea creatures use sound to communicate underwater. There's a great deal of Canton history to be found at the William McKinley Presidential Library and Museum and the nearby Westlawn Cemetery, where names like Timken and Hoover can be found. The Canton Cemetery Association and the company Next LLC want your remaining history to go well, too. So they're playing host to a Preserving Legacies event at 1 o'clock today at the museum.
The variety of different expertise to address those situations as they come up for the seniors, and not just the seniors, but their adult children as well.
That's Joe Patelicki. The Next LLC says it is not a sales presentation. Refreshments and a free tour of the museum are included. And if you want more details on this, you'll find it at WHBC.com. Well, the Cleveland Browns will hold a long-awaited press conference today to introduce their new franchise quarterback, Deshaun Watson. It's expected to start at 1 o'clock this afternoon. Andrew Berry and Kevin Stefanski will be there as well. The Haslams are expected to speak later in the day. We will have the press conference today for you at 1 o'clock right here on 1480 WHBC. I'm Pam Cook.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Hot Buy store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy.
Spring has sprung at Studio Arts and Glass. The hummingbirds will return, and Studio Arts and Glass has the feeders. Wind chimes, felt birdhouses, and garden art all make great gifts. Are you going to the beach? Then you need sea glass. Sterling silver and sea glass necklaces, earrings, and bracelets. Studio Arts and Glass open Monday through Saturday, 10 to 6 on Apple Grove and 77 in North Canton. StudioArtsandGlass.com.
Your severe weather station, News Talk 1480 WHBC.
Here's your Accuweather forecast. Breezy and cloudy, shower possible this morning. Some rain in spots for the afternoon. High today 45. Cloudy with a rain or snow shower in spots tonight, low 36. For tomorrow, a couple of showers of rain or snow. It'll be a chilly day. Windy in the afternoon, high 42. On Sunday, colder, a bit of snow at times. Little or no accumulation. The high Sunday, 32. I'm Steve Williams for News Talk 1480 WHBC.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Okay, we are back. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, Brad and I are talking with Dr. Kirby Sweitzer, surgeon, and Meghan Woods, RN, cancer nurse navigator with Cleveland Clinic Mercy Hospital. We have a lot more to cover this morning, so let's get back to the show. I guess you said earlier, mentioned earlier that the prep is one of the things that really discourages people from getting or having a colonoscopy. Is there a way to simplify this evacuation of your bowel? Like, I get people who tell me, I got to have a big meal before this test because I'm going to have to get rid of whatever tomorrow morning. So why do they think they need a big meal?
Well, that's a good question. I don't think the big meal really plays into it a whole lot. Obviously, people don't like the prep for a colonoscopy. They claim that's probably one of the worst parts. But the setup is primarily to be able to get rid of everything in there so the doctor has a really good chance of seeing what is in the colon. They can visibly see everything. But eating a large meal, I haven't heard that one before, but that won't really have too much impact on it.
We hear that in the drugstore all the time.
Well, only if it's multiple large meals that have a lot of red meat and fat in them.
Yes.
Over years.
So what are the signs and symptoms of colon cancer? Will we notice anything, I guess?
Well, the symptoms of colon cancer, there may not be any symptoms right away. And that's kind of the downfall with colon cancer because it's such a slow growing cancer that symptoms don't really appear until the mass is too big and there's other complications going on. So signs and symptoms that you're going to look for is any change in bowel habits, which could be diarrhea, constipation, a narrowing of the stool that could last for several days. But again, those may actually be latent symptoms. So that's why it's so important to get those screenings done. You could also have rectal bleeding with bright red blood. If there's blood in the stool, that's a problem. Sometimes people experience a lot of cramping and abdominal pain and weakness and fatigue and an unintended weight loss. So those are all symptoms that you're going to want to look for and that you need to relay to your physician. I know it's not overtly comfortable talking about those things, but that conversation with your physician is going to be a lot easier than the conversation you may have with your family once you're diagnosed with stage 3 or stage 4 cancer. So we kind of have to drop the stigma of talking about bowels and bowel habits, and just let your physician know what's going on with you.
Okay.
All right. Well, why don't we let's talk about some side effects from treatments or some treatments.
Yeah, one of the other aspects of that is, if you have symptoms, it's already probably fairly far more advanced. The exception to that is rectal cancer, which is low down, and then oftentimes you can have things that will look like you can have problems moving your bowels or feeling of cramps in your anal region, that sort of thing. But the biggest thing is anemia. I mean, asymptomatic is number one, but if you have anemia, then the question is, where are you losing blood? There's a lot of reasons for that, but one of the things is it upper or is it lower or is it colon? So one of the workups with anemia are doing endoscopies, upper and also the colonoscopy.
All right. Is it? Should we talk about treatments and like robotic surgery? Are we there yet, or do you have other things you want to cover?
We talked about some of the ways that we can treat colon cancer, and so the best way of which we've been emphasizing all morning is to screen. Make sure that you have the screening done, and then avoid anything else. As the colon, if you find the colon cancer, then you have to ask the question, which is the best way to treat it? And the mainstay is surgery, and surgery can be done in many different ways. We've done open surgery for over a century very successfully. The other way to do it is laparoscopic or robotic surgery. So I view robotic surgery as an adjunct to laparoscopic surgery. So laparoscopic robotic surgery is going through small holes and then operating with instruments that go through those holes that are called ports. The advantage of the robotic surgery is that it's 3D, so it's not two-dimensional. And also you have wrist articulation. So the instruments, instead of like little pieces of sticks, which are hard to sew, which is hard to dissect sometimes, you can actually have a wrist motion. I've shifted over the years. When I first started, about 80% of my colon surgeries were open and about 20% laparoscopic. Over the years, I moved into almost all laparoscopic surgery. And then when the advent of the robot came out, I'm now doing about 80% of my colon surgeries robotically, about, I'd say, probably 18% laparoscopically, and about 2% open. You always have to be prepared to open. Open rate for robotic or laparoscopic surgery is somewhere between 2 and 4%.
Interesting.
Okay.
And then along with surgical interventions, if you're diagnosed with an advanced stage, that's when we start talking about and looking at chemotherapy. And chemotherapy can be administered prior to surgery or after surgery. And there's some side effects that come along with chemotherapy. that includes nausea, vomiting, diarrhea, numbness, and tingling in the hands and feet. Most side effects are dose dependent, and they usually stop after chemotherapy is stopped. Now, in this day and age, we have a lot of medications that we use to help with those side effects. So the scary scenes that you see in movies where people are extremely ill and sick, that can still tend to happen, but we have a lot of medications now that can actually combat those things and make it a little bit more pleasant. And sometimes, too, with advanced stages, if the disease has spread to other parts of the body, they may start to incorporate radiation. And in those cases, that's just to treat symptoms. If you have, tumors growing in different parts of your body, it could cause some side effects. So radiation would be able to shrink those tumors down and cause a decrease in side effects.
Talking about radiation, this is one of the differences between rectal cancer, which is low down by the anus, and colon cancer is that rectal cancer, one of the gold standard is treatment with chemotherapy and radiation prior to surgery if it is involving going through the bowel wall. So that's one of the differences and nuances. And this is why you need to have, a really good team that deals with cancer consistently. That go through tumor boards, that go through presenting these patients, that get multiple input of physicians and nurses. This is also where the nurse navigators, I think, come in really shine, is trying to work people through this process, to work with people when they have these symptoms. So, yeah, we do have a lot of good treatments, effective treatments for colon cancer, but it's important to emphasize, again, the screening aspect, because if we catch it early, the survival rate is so much better. If you have an early stage colon cancer, the 5-year survival rate is around 90%. If the disease is spread already outside the colon, that drops down to a 5-year survival rate of around 10 to 14%. So it's very difficult to say, hey, you have colon cancer, you're going to survive this or not. But if you catch it early, if you catch it before it invades, if you catch it before it even turns into a cancer, it's incredibly important. Again, screening is the key.
I always heard that radiation, once you radiate a part of the body, that you cannot operate or surgically, whatever. Is that true, or healing is hampered with radiation, or not true?
Dr. Sweitzer, I'll probably turn that over to you. Paul was asking if once an area is radiated, if it is more complicated to perform surgery then.
Yes, radiation affects the cells, that affects all kinds of cells, all the DNA, but it's really effective on DNA that's turning over or making DNA fast. That's why it's more effective in colon cancer. So yes, if you have, especially talking about rectal cancer, it is more difficult to do the surgery, but you have a little bit of a window. So radiation initially starts to have a lot of increased blood flow, a lot of friable tissue, and then it kind of decreases a little bit as it kind of scars. And as it scars, it goes up, and you end up with really dense adhesions and scar that you can't deal with. So there's a window there of about 12 weeks, 10 to 14 weeks or so, where it's kind of ideal to do the surgery. If you do that, there's really no increase in complications. And sometimes the radiation and chemotherapy before you deal with the rectal cancer is beneficial because it shrinks the tumor and makes the surgery easier.
Okay. We've had many guests on speaking about hyperbaric oxygen. Does this fall into a game plan here? If we over radiate or surgically too soon, too late, what's your answer to that?
Talking about hyperbaric oxygen, that's a very good question. So in some radiated tissues such as the head and neck area, it's very clear that hyperbaric oxygen, which let me just explain briefly what that is. That's an area where you quote unquote dive people. So what you do is you put them in a chamber, you increase the pressure just as if you were diving down underwater, and you give 100% oxygen. So it forces the oxygen into the tissues in a greater volume or a greater percentage. So yes, there is some evidence that, especially on long-term aspect of radiation in the rectal region, a lot of people will have radiation proctitis and stuff. There is some good evidence that hyperbaric oxygen treatments are beneficial. One of the things that happens with radiation treatment is it destroys small vessels. So you end up with a small vessels being destroyed, and the hyperbaric oxygenation increases growth of new vessels.
Okay. Our third break is here. You're listening to Health Matters with the Medicine Center Pharmacy, and we're talking with Dr. Kirby Sweitzer and Meghan Woods, RN, Cancer Nurse Navigator with Cleveland Clinic Mercy Hospital.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Hot Buy store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off on Hot Buy store in Louisville, next to the Medicine Center Pharmacy. When you list your tag sale with Genuine Estate Services, you will experience professional sorting, researching, staging, pricing, and marketing of your cherished possessions. They have a large staff hosting your sale also, and they are very efficient. Call Eric at 330-206-0974 or log on to Genior, spelled Jenior, estateservices.com for more information. When you list your tag sale with Genuine Estate Services, you will experience professional sorting, researching, staging, pricing, and marketing of your cherished possessions. They have a large staff hosting your sale also, and they are very efficient. Call Eric at 330-206-0974 or log on to Genior, spelled Jenior, estateservices.com for more information. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. If you haven't gotten your COVID vaccine shot yet, you've got to get to the Medicine Center Pharmacies in Canton, Louisville, Minerva, or New Philadelphia. We are waiting for you and have vaccine. Call or stop in your closest Medicine Center Pharmacy, and we'll take care of you. Getting a COVID vaccine will save you from getting very sick. So hurry and get on with protecting yourself. The Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
Kids Fest is inspired by Wishes Can Happen.
Kids Fest is going to be so much fun. There's going to be all these cool bouncy houses and inflatables to run around in. Thank you to DeVille Properties. Canton Kids Fest at Canton Civic Center. See you there!
On March 26th.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us, and let's get back to the last segment of the show.
All right, doctor, is there any research being done as far as colon cancer treatment and prevention?
Okay. Well, I think that the next thing we really want to cover is the research aspect and what's happening. So, colon cancer has been researched for many, many years, and it's one of the more mature cancers that have been looked at. And so, the research is done by trials. And I would suggest that anybody who has themselves or a family member that's involved in having a cancer, see if there's any trials available. What trials do is it answers questions that we don't know. Is A better than B, or is A worse than B? And we don't know that unless people enter trials. And so there are ongoing trials in the Cleveland Clinic, Mercy Hospital, and we participate in many of these. There's a whole lot of trials. Some of them are worldwide, such there's a trial going on now about fiber, amount of fiber in your diet. There's always new studies that are coming up, and this is again where the nurse navigators come in very well. They keep track of this, and they can kind of guide us on what kind of trials are there. We also have specific nurses that deal with trials specifically. So if you want to take and see how many trials are present, there's right now over 4,000 studies in colon cancer. They're either starting in process or finishing up. You can go to clinicaltrials.gov, and you can have a search engine there that will look at all these. Our Cleveland Clinic trials team is always happy to answer questions about available trials and risk, and if you would qualify or not for those.
Okay. Well, let's. We've got about 5 or 6 minutes left. So, how about we talk about the single most important words of advice for our listeners that you both have for preventing colon cancer?
The other thing that I think we'd really like to talk about, and maybe Megan, you can talk about this a little bit more, is what we can do to give the best advice to the listeners, to our patients, to our families. And maybe you can go through and list some of those things. We covered a little bit earlier, the aspect of lifestyle changes, but I think that can't be emphasized enough.
Yeah, lifestyle changes are huge when it comes to talking about any type of cancer, but with colon cancer specifically, being able to change your diet, making sure that you're exercising, you want to eat lots of fruits and veggies, make sure that you're doing some exercise every day. But the biggest thing, and this has been echoed throughout this entire program, is the importance of getting screened. So if you're 45 or older, talk to your doctor. If there's a family history, talk to your doctor. If you're having any of the symptoms that we talked about, talk to your doctor. Because really it comes down to being able to diagnose this at an early stage, or maybe even to prevent it completely. And that all comes down to screening. Speaking personally, I'm kind of the poster child of being non-compliant, and I tend to deny and ignore symptoms. But something that I will do is I will listen to my loved ones. So I would encourage everyone to, if you have somebody in your life that it's time for them to go get their screening done, just poke them a little bit. Because even if I won't do something for my sake, if a loved one would ask me, I would go and have it done. So that's the importance of getting screening at such an early stage. So that's my best advice. Go get screened.
I would echo that, besides the lifestyle changes, and definitely, watch the obesity, your weight a little bit, and make sure that you don't smoke or get help from quitting smoking. But screening is critical. Every pop we take out 5 to 10 years later would be a cancer if we don't take those out. Mm-hmm. And so it's incredibly important to catch colon cancer before it turns into cancer in the polyp stage. And if it has turned into cancer, catch it very early so it can be cured. There's nothing more satisfying to surgeon colorectal surgeon than to take someone who has a colon cancer, remove it, and if it's early enough stage, not in the lymph nodes, not spread, that patient is cured. You would still have to follow up, but that's just a very satisfying aspect that a surgeon has a relationship with their patients. But screening, I can't emphasize that enough. And do it any way you want to, but that's really important. And I think that you need to know that Mercy Medical Center, Cleveland Clinic Mercy Medical Center is here in this area. It's associated with, a huge cancer center that's known worldwide. We use a lot of their protocols and everything else, and we can give you probably the best care, or some of the best care, or at least get you to where you need to be. If so, don't hesitate to contact us. Contact number is 330-430-2788. That's 330-430-2788. Or you can get on, if you're computer savvy, myclevelandclinic.org. myclevelandclinic, all one word, .org.
Okay. I think we're out of time, right, Brad?
Pretty close.
Okay. Thanks, Dr. Kirby Sweitzer, past president-elect at Mercy Medical Center, and Meghan Woods, RN, cancer nurse navigator. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Studio Arts and Glass and Genier Appraisals on the Quotations. As always, we thank your listeners for listening to Health Matters with the Medicine Center Pharmacy. Have a healthy week. We'll see you again next Friday right here on News Talk 1480 WHBC.